The situation grim, the healthcare system under dire strain as the rate of COVID-19 infections steadily climb. And all this as the Bahamas continues to battle low vaccination rates. The government then made a move today intended to contain the situation that could quickly get out of hand, as the Minister of Health confirmed the presence of the Alpha and Iota COVID-19 Delta variants in country. Cleopatra Murphy has the latest details on the COVID-19 pandemic.
The surge in COVID-19 cases has prompted a return to stricter COVID-19 measures, with Minister of Health the Honorable Renwood Wells announcing a new 10 p.m. to 5 a.m. curfew for New Providence, Grand Bahama, North and South Eleuthera and Harbor Island, set to take effect Monday. He announced other measures intended to curb the uptick in cases during a Ministry of Health press conference.
RT-PCR tests will be required for travel from New Providence, Grand Bahama, North and South Eleuthera, including Harbor Island. This applies to persons who are not fully vaccinated. For New Providence and Grand Bahama, religious worship will be limited to 33% of occupancy capacity of the religious facility. Services are to be limited to 1 hour, and all safety guidelines of the Bahamas Christian Council are to be followed.
Funerals and cremation services are no longer allowed indoors, and funerals are restricted to the graveside, with a maximum of 30 people excluding officiants. Repasts are not allowed, wedding attendance is now confined to 30 people excluding the officiant, exercise groups are restricted to 10 people, and no group or sporting activity will be allowed. Groups on beaches and parks have been capped at 5. Athletes can train, while gym and movie theater capacity is reduced to 33%.
In regards to restaurants and dining, dining is restricted to outdoor and takeaway services, and it is encouraged that there be no loitering of groups outside restaurants or at the fish fry. These restrictions, however, do not apply to hotel properties.
Spas are also closed, and for the entirety of the Bahamas, private gatherings are limited to 5 people unless attendees are vaccinated, and persons can only campaign if fully vaccinated. This while campaign teams are restricted to 5. The renewed tightening of restrictions comes as health officials reported 110 new cases of COVID-19 in the Bahamas and 280 deaths as of Thursday. With 100 cases reported on July 17th, Wells says the Bahamas experienced deja vu, as such numbers were not reported since September 2020. Hospitalizations have also peaked, with 92 reported on July 2021, further straining the healthcare system at facilities on Grand Bahama and New Providence. Wells acknowledging that the situation at the Princess Margaret Hospital is critical.
There are 6 wards closed to new admissions because of COVID-19 exposures. This has reduced bed capacity of PMH by some 96. Therefore, there are approximately only 32 beds currently being used for COVID-19 patients.
27 of those are in the Special Pathogens Unit, comprised of 3 tents given to government by Samaritan's Purse. Wells says the majority of hospitalized cases are among the unvaccinated, and patients hospitalized range from ages 27 to 86. While vaccination is a key tool to fight the virus, a tranche of 33,600 doses of AstraZeneca from COVAX expected in the country on Monday has again been delayed, now expected the first week of August. He says other vaccines are also being sourced.
We are also expecting to receive the Pfizer vaccine allocated through the COVAX facility. All of these vaccines are expected to bring and to be in country, arriving as early as the first week in August.
As a means of getting more people vaccinated, Prime Minister the Most Honorable Dr. Hubert Minnis this week announced government was in discussions with cruise lines about transporting Bahamians to the U.S. to be vaccinated. Chief Medical Officer Dr. Pearl McMillan addressed the possibility of this being a super spreader.
The suggestion that it may be a super spreader event, I guess that is so. However, if the necessary public health measures are actually implemented, there is a possibility that, we will not move in the direction of a super spreader event. I believe that recommendation just related to where we are as it relates to seeking to get our population immunized.
McMillan says the Ministry of Health's team, where necessary, also seek outside advice and would not support something that would constitute a super spreader. Cleopatra Murphy, ZNS Network News.
If you missed anything, we've got you covered. Subscribe to our ZNS Network YouTube channel and follow us on our social media platforms, Facebook, Instagram, and Twitter, for breaking news, live event coverage, web exclusives, and much more.